You can have three things in every healthcare system. Those three things are 1, affordability, 2, universality, and 3, quality. However, every healthcare system can only guarantee no more than 2 of the 3 at a time. We begin our podcast right there.
Computers are live, mixers up, levels are good, equalizer's good, ready channels 1 and 2. Mic is live in 3, 2, 1, roll it. Welcome, listeners, to the My Practice, My Business podcast, where we teach dentists and their teams how to reclaim forgotten profitability in dentistry with our clinical business of dentistry training. And now, the host of our show, the clinical director at My Practice, My Business, Dr. Rob Thorup.
Oh my, look what medical has discovered. Tell nobody. Upgrading. That's right. Medical has discovered upgrading. Over the last several months, I've been talking with physician friends of mine, and I'm continually blown away with what they have been facing over the last 15 to 20 years. I've learned that orthopedic surgeons only make a fraction of what the hospital charges the patient's insurance. In Utah, they literally make $1,800 for a hip replacement surgery and $1,200 for a shoulder replacement surgery. Yet the hospital will charge roughly $30,000 for the hip and about $18,000 for the shoulder. I know of an ophthalmologist who is calling it quits due to the fact he only gets roughly $1,200 for each cataract surgery. He simply said he cannot even break even anymore with those type of reimbursement rates. I don't want to open up a can of worms, but dentistry is already there. The hospitals pay for all direct operating costs, including the payment to the surgeon. We bill for the entire amount of healthcare services within our dental practices and then hope we actually make something at the end of the month, right? This is where we dental surgeons have seen our profits decrease over the years, and we have to do something about it. Otherwise, we will feel like doing something else. I can't even imagine what it must feel like graduating from dental school with over $500,000 of debt. Yet that's what our recent graduates, that's what they're seeing, approximately $500,000 or more in debt. Medical has almost completely left the free market system and has become a heavily regulated entity. It has become increasingly subsidized, which has completely led to increased costs. Think about your own dental practice and look at the things that have now become regulated within your dental business. Those regulations, which in the beginning seemed so minor, have presented increased costs to your practice. It still bugs the daylights out of me that we have to pay for the x-ray heads in our offices. Why is it that is so necessary? So that the state radiology tech can come by my office every 3 years to tell me there is still no gamma ray scatter in my office? Is that why? Wow, I'm shocked. Honestly, what does it matter whether I have 2 or 4 x-ray units in my office? Is it going to cause global warming? Is it going to cause an alien invasion? It's just another grasp on the freedoms we enjoy and one step closer to regulating the dental sector. The good news is that physicians are beginning to figure out how to capture their lost revenue that they experience from the lousy reimbursement rates that they have been experiencing for years from the medical insurance industry, and they are becoming very business savvy in doing so. Several years ago, I began to look for a primary healthcare provider for my wife and I. Our medical insurance we obtained no longer had our current physician as a provider on our plan. Sound familiar? In my dental practice, we pride ourselves in customer service, going above and beyond for our patients. Apparently, the first 2 medical offices I went to on our medical plan didn't get the Disney Experience customer service memo. I was talking with one of my awesome patients about what had happened, and she referred me to her physician who she attested was awesome. And he was. And so was his team. We finally found a great healthcare provider from one of my patients as a referrer. During my hunt for a great general medical practitioner, though, I learned about a group of general practicing MDs in the Salt Lake Valley who provided what they called a concierge medical service. Wow! This really intrigued me. What they would do is limit their practice to roughly 1,500 patients who would each pay $1,500 per year for value-added services. Those services included, 1, 24/7 patient access to their assigned healthcare provider. This meant each patient, like you and I, actually had the doctor's cell phone number, just like my patients do with my cell phone number in my dental practice. Number 2, of course, that's unheard of in medical. Number 2, if you get sick, you are seen that day. Not next week, not next month, but literally right then. Number 3, access to emergency or surgical procedures immediately. 4, if you travel within the USA, there were other groups across the country that your primary physician could refer you to. And 5, if you just needed some meds to get over your illness, they would simply treat you over the phone, just like we see with other modes of healthcare. You could actually FaceTime them. There were additional benefits, but I think you get the idea. Having been offering my patients upgrades and value-added services since 1991 and charging my patients an additional fee for the very best dentistry has to offer, whether insured or not, this medical offer was a no-brainer for me. I wanted it. I was getting ready to make the choice when I connected with my current medical healthcare provider, who my patient referred me to. If my current medical healthcare provider provided that kind of service and started limiting his practice, I would join today. It amazes me when I go to my current medical doc how shocked, though, he and his staff are when I drop $100 at them for lunch to buy their team something to eat. What doesn't amaze me is how quickly they get me in when needed. Kind of like Pavlov's dog, right? I drop 100, I got royal treatment. Do you think it's because I pay them with food or value-added care? Yeah, I think so. I know what his reimbursement rates are, and buying lunch for the doc and his team is the least I can do with what they face every day in reimbursement rates. Just yesterday, I had one of my favorite patients in to see me. This is so funny. We got talking about dental and medical care, and she was grateful for the fact I got her husband in the very day he had a major tooth pain, and I fixed it that day. Throughout the years, I've weeded out patients who just shop for dentistry and have an awesome patient base who actually wants quality dental care. Patients who not only want good oral health, but also show it most of the time with great home care. Those are the ones I want. And most important, my patients come from all walks of life with incomes that are completely across the spectrum, from the lowest incomes to some of the highest income earners in my area that I practice in. Oral health care is simply important to them. They're no respecter of persons, wages, or who they are. As they understand poor oral health care, they understand this can affect the rest of their overall health. They get it. Well, my awesome patient told me about how she upgrades to have better medical care. I said, what? Really? And come to find out, it was exactly what I had discovered a few years ago, only the name has now changed to, ready? MD VIP. Like medical doctor, very important patient. I don't know what the actual acronym is, but it is MD VIP. Let me be very clear. These MD VIP patients each have their own medical insurance. However, in addition, they are paying an extra $1,500 to $1,800 each year for value-added services from one of those MD VIP physicians. This is no different than what we teach here at MPMB, My Practice, My Business, only we are able to take it to a whole new level in dentistry. Let me just read this. MDVIP is a national network of primary care doctors who see fewer patients so they can focus on delivering personalized medicine. MDVIP's affiliated primary care doctors provide personalized primary care. Physicians specialize in internal or family medicine and are committed to giving you the time and attention needed on your path to healthy living. Through a comprehensive primary care program, you will build a strong collaborative relationship with your doctor. MDVIP affiliated personal physicians see fewer patients and are focused on your individual health and wellness needs. They have more time to give you one-on-one attention, to answer your questions, address your concerns, and develop a customized wellness plan. Your path to a personalized preventative health care starts here. Wow! Medical is finally pushing back. But when this medical concierge service began back in 2015, the Obama administration went after him. They tried to shut it down, calling it all kinds of names, but the medical care doctors won the battle. Even the Surgeon General battled the Obama administration on behalf of physicians nationwide and won because it was not exclusionary. Anybody could join. This was fantastic for medicine, even better for the patient. Check this out on the battle in 2015 that we didn't hear anything about during the push for Obamacare. In the Republic, Arizona, it says some family doctors fed up with assembly line medicine and reimbursement pay from insurance companies have honed a pitch for the most loyal patients. Pay an annual fee of $1,500 or more in exchange for perks such as ... the things we went into. And then U.S. Healthcare Spotlight, David versus Goliath, concierge care battles continue. The big story, it said in the health news today, is about a battle currently underway in the U.S. healthcare system that has arisen in the wake of the implementation of Obamacare, and in particular, a growing trend known as concierge medicine. That was 22nd April of 2015. In the end, you guys, guess who won the battle with the Obama administration? The physicians did. I've said it before and I'll say it again. Just because you contract with a PPO plan, it does not mean your hands are tied behind your back when it comes to getting paid fairly for your high-end products and services. Think about it. Our physician colleagues are getting paid $1,500 to $1,800 per patient each year as an upgraded value-added service on patients they are already contracted with on their medical insurance. These physicians had to pay a company to teach them how this can be done. Just like My Practice, My Business, our company teaches dentists how this can be legally, ethically, and morally done in dentistry. Our clients love us. You will too. It's time all of us get paid fairly for what we do instead of subsidizing third-party payers who could make our lives easier, but they choose not to. Thank you so much for tuning into the My Practice, My Business podcast. You can find additional podcasts you may have missed that will help you with your dental practice at Apple iTunes Podcasts. And remember to become a subscriber to our podcast. Many of you have asked how to help support the My Practice, My Business podcast. If you have enjoyed the program and information you received today, the best way to help is to leave us a 5-star review. Thanks again for allowing us to be a part of your day.